want to go back to that Bill Gurley speech about agency capture, the presentation he did for the All In podcast. We talked a bit about earlier in the program. I wonder if our next guest, C.S. Tucker, who knows everything about health insurance in America, I wonder if he knows this story. This is a great one. We told you the one about the antigen tests. Well, he did. We brought that to you. Bill Gurley, this billionaire venture capitalist out of California, Silicon Valley. Here's another one he tells. Right. Regulatory capture. Regulation to protect industry incumbents, not to increase competition for the benefit of the consumer. They're not protecting you. They're protecting the interests that finance them. The story plays out over and over and over again, so get with it for people who don't understand this dynamic. The story of Epic Medical HR software and how Obamacare was so beneficial to Epic, which is actually a Wisconsin-based company. Listen to the story as brought to you by Bill Gurley.
That is the largest player in medical EHR software, medical records, and this is their CEO, Judith Faulkner. Now, get the year right, 2009, Obama put her on his Health IT Council. She was the only corporate representative. Should not surprise you that she's a major donor to Obama. Now, Obama passed the American Recovery Act. That was his big piece of stimulus, kind of like Biden's Inflation Act that happened recently. And tucked underneath that, easy to hide in this big bill, is an act that was, the acronym's high-tech. It's this health information technology thing. And then they created an agency called ONC that oversaw it. Now, this is the part you're not going to believe. They came up with a brilliant idea. I have to assume she helped encourage this. Doctors would receive $44,000 each if they bought software. $38 billion. This is true. You can look it up. I'm not making it up. $44,000, give it to a doctor, implement some software. Many of you run companies, that'd be pretty cool, right? The government passed a law. If they buy your software, they get money. Make it a lot easier. Now, you may be thinking, are doctors needy? But here's the catch. You remember, this happened because of the mortgage meltdown. Doctors own multiple homes, so they have multiple mortgages. So they, they probably needed the assistant.
Yeah.
Now, there's two more things about this act that are also unbelievable. First, there's a flaw. If someone said, I'm going to pay people to buy software, most people would be like, well, you're going to have a problem. They're going to buy it, and they're not going to use it, right? Well, they thought of that. So guess what? The second phase, doctors got paid $17,000 more to prove they were using it. It was called meaningful use. Plastered all over the website of all the HR vendors at the time. It gets even better. So the ONC decided the threshold of features you would need for your software to comply with this mandate. And I'm assuming they kind of took Epic's feature set and plowed it into this spreadsheet. But they got the Department of Justice to enforce people that didn't have the feature set that were getting the payments. And you had 3 record fines, $155 million, $57 million, $145 million against the lesser competitors of Epic. Unreal. If you've studied the innovator's dilemma, the way startups disrupt is they come in with lower feature products, but a feature that really matters to the customer and a simpler product, and they move up. They put a brick wall there, so you couldn't come up. It's just amazing. Obama, in an interview with Ezra Klein, said this was the most disappointing part of Obamacare. I mean, I think if any of us were in the room when they scratched this thing out, I could have told them it would have failed. I mean, paying people to do stuff is just, it's not going to work. Now, you may ask, am I unhappy with Judith? I'm disgusted with it, but if I were a judge in the Olympic regulatory capture competition, I'm giving her a 10.
And that's how it works. And by the way, Obama's disappointed. That was the thing most disappointing about Obamacare. The whole thing was agency capture, was regulatory capture. That's the whole thing. That's not a bug. That's a feature. Mandate it, subsidize it, penalize those who don't follow it, and protect the incumbents. Protect the selected incumbent. In this case, Epic HR software out of Wisconsin. What a great story. So telling. I don't think people have enough of appreciation about how regulatory capture works, how ubiquitous it is. They buy the propaganda, going after big guys to protect the little guy when they're doing exactly the opposite. 180 degrees. For more on that industry in particular, please be joined by C.S. Tucker, founder, principal broker, healthinsurancementors.com. C.Steven Tucker, thanks for joining us. Did you know that story about Epic?
That's a new one for me. I am aware of the mandate where you had to switch, everyone had to switch medical providers from ICD-9 codes to ICD-10 codes at their cost, of course. And if you ever want to upset a physician, ask him if he's received his meaningful use reimbursement check this month.
Oh, interesting.
Under the accountable care organizations that were set up, of which Advocate is the largest in Chicagoland. They're part of an ACO as well. Most of the pioneer ACOs that were introduced under Obamacare back in 2014, most of them have gone bankrupt now. But we got one here, and that's Advocate. So
well, but the larger fallout from this too, like in every other sector, is that did Obamacare increase competition, bring more entrants into market? No, it consolidated the healthcare insurance industry, of course.
Of course, we've lost 170 health insurance companies in this country since 2014. We've lost 20 of them from the state of Illinois. We, in fact, now are one of the lucky states, it's probably the only reason to be lucky to live in Illinois, is that we're one of half the states in our union that has a national PPO plan in the individual marketplace with Blue Cross Blue Shield, which you can use at major hospitals like MD Anderson, Barnes-Jewish, Mayo Clinic, Northwestern, etc. But the other half of the country only has HMOs. And as you may already know, HMOs should be avoided like the plague as long as there are PPOs available. If for no other reason, they were designed by Slick Willie and Crooked Hillary Clinton, which would be the main reason never to buy an HMO. But this administration is currently doing another thing to protect their sweetheart deals under Obamacare, and that is they are attempting, under the Biden regime, to wipe out non-Obamacare health insurance policies, formerly known as short-term policies. If you remember, back in 2017, the Jobs and Tax Cut Act under President Trump, he came into office and knew a little bit about healthcare policy since he had 535 companies, 35,000 employees. And he asked, why is it that those who are healthy cannot buy short-term health insurance, which is major medical health insurance, extremely comprehensive, unlike our friends on the left who say that it's junk plans. They are not junk plans. But anyway, so he said, why is it that you can only buy these policies for 6 months, or in some states, 3 months? Well, why is that? And the reason that was is because Barack Obama realized that that was impinging on Obamacare, because these plans are half the price of Obamacare plans. And they do not carry $9,000 per person out-of-pocket risk exposures. They are 100% plans. You can buy a $2,500 deductible, 100% coverage afterward, and they include national PPO coverage. And so after he passed this law, if you remember, I was called down to Springfield to testify to try to stop the legislators from limiting short-term policies from 12 months, as we enjoyed them under Bruce Rauner, down to 6 months, making them effectively useless and dangerous to use. And of course, they ignored me. But rationally led states, there are 27 of them currently, adopted the expansion of short-term policies under President Trump, allowing people to keep them for 12 months, 24 months, or even 36 months in a row with no rate increase the entire 3 years. And so in 27 states, you can currently do that. But of course, the Biden regime is seeking to kill that. And they're trying to kill it as soon as possible. And so all of those people.
Why?
Because it impinges upon Obamacare enrollment. Why would someone buy an HMO in one of the half the states that only offer HMOs, which restricts their choices at the best hospitals, and spend twice the amount of money if they can buy non-Obamacare coverage, short-term health insurance from companies like United Healthcare, the largest health insurer in America, at half the price? Why would they do that unless they were forced to do that, unless that option was taken away from them? And that is precisely what the Biden administration is attempting to do right now as we speak.
I want to tell this story to get your reaction. This is like a story of how messed up the industry is because, of course, government is the primary mover. A friend of mine here in Chicagoland, he has an accident, cuts his arm, needs 25 stitches. Ultimately, he finds, nobody knows what that costs. He's asked, but ultimately, which is the first problem. But
he didn't have to take an ambulance, did he? Did he drive himself to the hospital?
Yes, no ambulance. $2,500. He's got a primary and he's got a secondary insurance. Primary insurance picks up all but $216, so he owes $216 on the $2,500 bill. Then he's
$226.
He owes $216 on the $2,500 bill. That's his portion, right? Then he submits all the information to his supplemental insurance, and he gets a check for $770.
What?
So he made $500 on getting 25 stitches. And then, of course, he took the $500 and he went to a massage parlor. But the last part is not relevant. The relevant, what's relevant
massage the stitches.
He is gonna start cutting himself in places of his body where he can do just sort of superficial wounds as a side hustle to make some money from his insurance companies. But I mean, seriously, 216. He owes 216. Now, obviously, the supplemental and the primary. I mean, they've got a full view of all of this. And he gets a $770 check from the supplemental, minus the $216 that he had to pay out of pocket from the primary. So he makes, the $554. What? How does that make sense?
Well, one slight correction. It's $226. So that is the Part B deductible.
Okay. All right.
That is all that one is responsible for when they have Medicare Supplement Plan G. So it just makes Medicare incredible, right? But there are also other things that can happen, as you mentioned, where there's overpayment and the patient is reimbursed.
But I don't think this is Medicare because this is
Medicare.
Oh,
this is Medicare.
This is Medicare.
There's only one type of health insurance in the world where your total out-of-pocket expense for all medical claims is capped at $226, and that is Medicare with Medicare Supplement Plan G. And people, when they age to 65, they cannot believe it, Dan. I have people who are doing whatever they can to age as quickly as they can to get to age 65 because they are coming.
Mike Scott is raising his hand in our newsroom. Yeah.
Right. They're coming from Obamacare where they each have a $9,000 risk exposure, regardless of the size of the deductible, by the way. And they're moving to Medicare where it costs them roughly $300 a month for everything. And their total out-of-pocket cost for all medical claims is $226. And if they cut themselves the right way, they might get a bonus check. So it's just incredible.
And of course, he called around to try to find out how much it costs to remove stitches, and no one could give him that number either. Nobody knows what prices are.
Absolutely not. I mean, this is another problem until we wiped out the beautiful idea of health savings accounts where you had an impetus to ask about price because you were putting in tax-free dollars into a health savings account, and the less you spend, the more you keep for retirement, right? So you had an impetus to ask, what does a colonoscopy cost? What does this procedure cost? Now, all they want to know is who's your health insurance? Who's your carrier? Let me see your card. That's it. So there's no price transparency, which is the problem. This is one of the reasons these costs keep going up and up and up. And the Biden administration is spending $60 billion to increase federal subsidies to families making $300,000 a year now. It's just remarkable.
We were talking offline, you and me, about this piece that I had referenced last week that was co-authored by John Goodman, who's a healthcare policy commentator, and apparently you have differences of opinion. But he essentially argued in this piece in the Journal that that under Obamacare, which was supposed to make health insurance available to people with pre-existing conditions, the actual result, this is what he literally said, the actual result has been the opposite. Obamacare makes health insurance as good as possible for the healthy and as bad as possible for the sick. And then he went through sort of an example of this out of Texas. And you contacted me because you listened to the show because you're intelligent, and said that what Goodman said is not exactly the case. So explain for us: is Obamacare doing that or not, making insurance good for the healthy and bad for the sick?
No,
it's not.
no. I mean, this is just nonsense. I don't blame John Goodman. I blame Beverly Gossage, his co-author, who's a Kansas state rep who happens to hold an insurance license. But whoever did the research, and I don't know who's editing the Wall Street Journal pieces anymore, but this is completely untrue. He states erroneously in the article, this is his quote: patients with serious disease often require the care of highly trained specialists who usually work at centers of excellence, but the family in Dallas, Texas will discover that their Blue Cross plan isn't accepted at leading cancer providers nearby, including Baylor University Medical Center and University of Texas Health Science Center. Listen, the Blue Cross policies are accepted at Baylor University Medical Center. Not only are the Blue Cross policies on the Health Insurance Exchange accepted at Baylor University Medical Center, but Baylor University Medical Center has their own series of health plans called the Scott and White Health Plans, which are, of course, accepted at Baylor because they designed those health insurance policies, because Scott and White Healthcare merged with Baylor University in 2013. In addition to that, Ambetters plans are accepted at Baylor. Now, he could say, well, the University of Texas Health Science Center is not accepted by Blue Cross. That's true. Do you know why? Because Oscar Health Plans cut the contract with Baylor, so Blue Cross, they don't even have to include the Texas Health Science Center because Oscar got that contract with the Texas Health Science Center. And another thing that's extremely disingenuous is he chose $70,000 as their adjusted gross income. $700 less than that, and they qualify for CSR, which is the magical second federal subsidy, which reduces deductibles and out-of-pocket expenses. So if they go $700 less on their income, which, by the way, who wouldn't do that? You take $700, you put it into a tax-deferred account, now your AGI is $69,300 instead of $70,000. Now you've got a zero deductible, and your out-of-pocket is not $9,000, it's $7,250. So the whole premise of the article, if we're going to attack Obamacare and we're going to provide an alternative to it, we must argue the case on the merits. We cannot come out with pieces like this where it's just completely. And then the most egregious statement made in his piece is that, quote, Obamacare plans have very skinny networks in every state. They tend to pay providers Medicaid rates or close to them. That is poppycock. Medicaid reimbursement rates are 78% lower than Medicare reimbursement rates, and private insurers, like those sold on the health insurance exchanges, like Blue Cross and Oscar and Ambetter, they pay hospitals and medical providers double what Medicare reimbursement rates, which is an average of 143% above the Medicare reimbursement rate, to as high as 199% above. So to state these things in an article as an argument against Obamacare is it's a futile effort, and it makes us look bad. So I have to address it publicly because it's just an awful.
Well, then, so then, I mean, as you review what Obamacare has wrought over the last 15 years or so, then what is your main gripe with Obamacare?
It's cost. Okay, understand that right now, today, if the Biden administration had not passed the American Rescue Plan and the Inflation Reduction Act, which did not reduce inflation, but what it did do is it took a family who in March of 2021, if they made $68,960, a couple, no children, okay, $68,960, they would qualify for no federal health insurance subsidy and would have to pay the shockingly high actual premium for a bronze plan, which is much higher, 260% higher than it was in 2013 before the exchanges opened, okay? What the Biden administration did was they passed the American Rescue Plan, and then they solidified the subsidy cliff increase under the IRA. So that same couple now can make $240,000 a year and qualify for massive federal health insurance subsidies. And if they have children, they can make $340,000 a year and qualify for massive federal health insurance insurance companies. So all that's going on right now is no one is addressing the cost of healthcare or health insurance. They're simply printing money and handing it to insurance companies and calling themselves heroes.
C.S. Tucker, founder and principal broker for healthinsurancementors.com. C.S., always appreciate your expertise and clarity. Thank you, sir.
Thank you, guys. Have a great day.
All right. Thanks so much. And he joined us on our turnkey.pro answer line. Coming up on Chicago's Morning Answer.
We'll see if we can help the Biden administration locate that F-35 that's gone missing at 8:38.
And later, new information about our Freedom Summit Chicago event. Yes, tickets are on sale now. Who's there? Who's going to be speaking? We'll tell you coming up. But now let's head into the newsroom. Here is Mike Scott.
8:32, clouds and rain, 59 degrees. The president preparing to address the United Nations. He will do so at 9 a.m. The White House says the president will reiterate U.S. support for Ukraine. The Marine Corps is suspending flights for 2 days after an F-35 stealth jet disappeared for hours when a pilot ejected over South Carolina's Sunday. Debris has been found. 5 Americans imprisoned in Iran are back on U.S. soil, having touched down this morning in Virginia.
The funds that were released are going to be used for humanitarian purposes. The U.S. will have complete